Okay, so now we're going to look at a few assistive devices or adaptive aids that may help or facilitate someone when you're helping someone move within their environment and surroundings and optimize their independence within the toileting task or within the home. So before I get into those, and this is just to repeat Barbara a little bit, is that you may want to look within your community what resources are available to either loan adaptive aids or equipment, or to call, if you do have insurance, to call up your insurance and see what your policy allows in terms of coverage for medical equipment or adaptive aids. I know most zones in Nova Scotia do have a Red Cross equipment loan service, so that might be something you might seek out when you're thinking about how you're going to set up these adaptive aids. And of course, you can often purchase these adaptive aids as well at medical supply stores or home health sections. So when you're thinking about the transfer, you may consider using a transfer belt to help with the transfer, making sure that the person, if they need glasses, that those are available and they have them on, hearing aids. A knee brace can help stabilize someone's knee when they go to stand and to walk. That might be helpful. And of course, a proper footwear that covers the whole foot and heel. And has a non-slip grip on the bottom. Now, not everyone prefers to wear shoes in the house, and so if they don't want to wear shoes in the house, the next best thing would be to wear socks that have grips on the bottom, and those are readily available and not very expensive if the person really just does not want to wear shoes in the house. But ideally, the shoe would cover the whole foot. In the living room, you're thinking about things to help someone stand up from a couch or a chair. So you can add furniture risers under the legs of the chair to make it higher. That's easy to make it easier for the person to stand up. There are devices that you can attach to a chair or a couch that provide a handle for the person to pull up on. So sometimes the person's upper body strength is better than their lower body strength, and so if they're able to use their arms more, you want to capitalize on that strength and provide them with sturdy armrests or a sturdy handle to hold to use. You may consider setting up a lift chair when it's just too difficult to stand up from a regular chair. And you're thinking about those nice firm armrests and having the chair high enough. Now, when you have a lift chair, the person with dementia may still need some help with the control, and that's something you'll navigate through as you try it with them. Sometimes multitasking between standing from a lift chair and also knowing which direction to use the control in can be too difficult for someone with dementia, but you'll know best in your situation what's going to work. So another handout that you'll have along with this workshop is how you pick the right chair. Right, and so if you're thinking about the body mechanics of sitting to standing, ideally the person would be closer to the edge of the chair, and then leaning forward before they stand up. The chair height would be adequate, high enough to help them stand up, but not too high so that it's uncomfortable when they're sitting down. And you want to have firm, long arm rests that the person can push up on, use their upper body as much as they can when they go to stand up. You want to try to avoid chairs that are unsteady, like rocking chairs or office chairs with wheels on them. Now, if you're looking at the stairs, if you do have your bathroom or bedroom on a different level and you're unable to set up on one level, then you're probably going to want to look at setting up the stairs in a safe way so that the person with dementia or the person with mobility issues can still access the rooms they need to get to. So if you're able to install a stair lift, that may be an option. Keep in mind the person still has to be able to transfer on and off the stair lift, and they may need some cueing or some help with the controls. Most medical vendors will provide a free assessment and estimate for an installation of a stair lift. If a stair lift is not an option, you may consider making sure that you have a firm, steady handrail on at least one side of the stairs, and sometimes even both sides, to give the person two railings to hang on to as they go up and down the stairs and to help keep their balance. Now, the bathroom is the one room in the house that most falls happen. And so for that reason, there's lots of adaptive aids and assistive devices that can help a person navigate within a bathroom the way that they need to do in their daily activities. So the basic idea around these aids is to provide something sturdy to hold during transfers and mobility or walking within the bathroom, and raising the height of seated surfaces to facilitate sitting and standing, and trying to avoid having to step over a high tub side into the shower. So for people with dementia that have difficulty with depth perception or understanding that the toilet, rather than the garbage can, is a place to sit, modifications like a toilet safety frame with contrasting color or grab bars near the toilet also offer that visual cue for the person with dementia to help outline where the toilet is and where they're supposed to sit down. And we'll look more at these aids when we do the actual demonstrations. So in the bedroom, you want to have clear access to the bed, the dresser, and the closet. This can help the person navigate easily throughout their bedroom. Consider having the person sleep on the side of the bed closest to the door or bathroom if they get up at night. Lots of people make some arrangements in this room to accommodate a walker or improve access to their bed, or to create an obvious pathway to an ensuite or to the door. A floor-to-ceiling pole may be helpful for getting in and out of bed, or a bed assist rail. Sometimes having the sheets turned down on the side of the bed will cue a person in later stages of dementia to get into bed at that area and then help them wind down to go to sleep. So there's a couple more assistive devices here for the bedroom. So again, it's important to understand the difference between a bed assist rail and the traditional sort of hospital bed railings that we see on hospital beds. So the bed assist rail is meant to help people move. It's meant to help people get in and out of bed. It's not meant to help people stay in bed. We want to encourage mobility and movement as much as we can for people with dementia and older adults. So a bed assist rail is something that helps them, and it's often placed up by the head of the pillow, or the head of the bed near the pillow. You may also have a portable urinal at the bedside or a bedpan handy if incontinence overnight is an issue. You may also consider having a commode set up beside the bed and then have it set up ideally against a sturdy wall or a sturdy piece of furniture so that when the person goes to sit down on it, it doesn't tip backwards. Now you can get commodes with wheels. They have brakes on them. So it just depends on the purpose of the commode, whether you need to be able to move it around or whether you just want to be able to keep it in one spot. So those are the things you're keeping in mind when you're thinking about a commode. And again, that offers the option to get to the toilet quickly when getting up to the bathroom at night, or when you're more tired is going to be more risky. So there is assistive technology available to help caregivers be alerted when someone is either trying to get out of bed unsafely or trying to get out of a wheelchair. Now there's the typical personal medical alert system that people wear around their neck or their wrist, and you can get the one that detects a fall. However, this would be something that if the person did fall, the risk for injury would be lowered because someone could get there quickly to help them. There are alarms and bed sensors that you can get that senses a change in position or a change in weight shift when the person goes from sitting on it to standing, that can alarm a caregiver. Or there's a technology where if a caregiver is sleeping in a different room and they have their cell phone with them, you can program the cell phone to alert the caregiver when the person has left the bed without alerting or alarming the person in the bed, because we know that can cause them to be startled and more upset. So when you're considering the setup of the bed, there are some obvious facilitators with having a hospital bed. So you're thinking about the changes in position a person must complete to go from lying to sitting when they're in bed and sitting to standing, and what we call bed mobility. So how does a person roll from side to side and adjust their position while they're in bed? And if self-care like bathing or toileting is happening in this area, then those tasks require either the person to move or a caregiver helping them to move. So hospital beds can be helpful to facilitate bed mobility and alleviate the amount of assist provided by the caregiver. You can bring the head of the bed up nice and high so that lying to sitting position is is a little bit easier. And you can raise the overall height of the bed up and down to help them either get into bed or out of bed. So for some people, if they're not wanting to get a hospital bed quite yet and they prefer their own bed, they may consider getting a foam wedge that you can place at the head of the bed to help raise up their head and upper body a little bit, and then also get a bed assist rail to attach to their own bed, and that gives them that sturdy handle to hold on to. So I always say that, remember, with hospital beds, it's important to understand the risks associated with the bed rails. Having these set up and having these up and locked can actually increase the risk of injury and death if the person is trying to get out of bed or becomes caught in them. So some people actually like the rails being up, as it does give them a sense of security and safety. But it is something to keep in mind if you do set up a hospital bed, and you may want to have a healthcare professional involved to help you navigate through those risks involved. Alternatively, you may consider having the bed or the hospital bed lowered all the way down when the person goes to bed, and then place a soft surface on the floor so that in case they do fall out of bed, at least the risk is lowered with a more soft and clear landing without the bed rails getting in the way.